So let's talk about something I'm really passionate about, which is dental implants. What's a dental implant? If someone is either missing a tooth already or has a tooth that's broken and non-usable, your dentist may suggest that you should replace the tooth or teeth with dental implants. Or you may do some reading on your own and read about dental implants. In the old days, years ago, when someone was missing a tooth, the dentist would have to shave away teeth on either side and replace the missing tooth with something called a bridge. Well, since then we've discovered that it's not really healthy to shave away normal healthy teeth, and dental implants came around about 40 years ago. The dental implant is a titanium structure that's shaped like the root of your tooth that's placed into your jawbone, and it acts as a permanent anchor to replace your missing tooth or teeth. The main criteria of whether or not someone's a candidate for dental implants at the moment is availability of jawbone. So because the implant is something that sits in your jaw, we have to determine whether or not you have enough jawbone available to place this implant. And that's done during the consultation process at an oral maxillofacial surgeon's office, such as myself. During this process, a x-ray is taken to determine how much bone you have, and from that we can figure out whether you have enough bone to hold your implant or not. If you don't have enough bone, don't worry. We have ways of growing bone, and this is another thing that I do routinely in my dental practice, is regenerating bone. So we can grow the bone that you need prior to the implant placement, and then once we've determined that you have enough, an implant can be placed into that bone. As an oral maxillofacial surgeon, I am specifically trained and skilled in both of these processes, unlike other dentists, because my focus on my daily routine is doing surgery. I don't make teeth or root canals or fillings. I just do surgery on an everyday basis, and having had special training after dental school, including medical school training, I am specifically trained to place dental implants and regenerate your jaw. There's also a determination of how many implants you might need. Now, if you're just missing one tooth or broke one tooth, or your dentist might feel that your tooth is no longer usable, then the answer is easy, you need one implant. But if someone's missing multiple teeth, or if someone has been wearing full dentures for many years, there are various options as to how many implants can be placed, ranging from 2 to 4 to 6 to 8, really depending on your financial abilities and what might be the best restoration. The best thing about dental implants is that they are permanent. It's something that you don't have to take in and out of your mouth. Once we place them and we are sure that they've healed properly, the dentist would then fabricate a tooth or teeth that will sit on top of this implant, and it acts like a regular tooth. There are really no dietary restrictions. You can eat whatever you want. You don't have to worry about your denture falling out in a restaurant, taking them out and putting them in a glass next to your bed at night. They are permanent replacement for your tooth. The important thing is to have a proper screening to determine whether or not you're a candidate, and to see someone who's qualified to do the procedure the best way possible.